The first case or reported case of the mystifying coronavirus disease in Nigeria was on February 27th, 2020. And the second case was reported on March 9th, 2020. Subsequently, the numbers have been on the rise. Latest figures from the Nigeria Center for Disease Control, NCDC, show that the country has a total number of 43,841 confirmed cases, with 20,308 successfully treated and discharged, while 888 deaths have now unfortunately been recorded in 36 states and the Federal Capital Territory. The daily chart of the NCDC in the past 5 months has indicated a rise in cases, but recently figures seem to show a slight decline in cases. The NCDC on the 2nd of August 2020 announced 304 new confirmed cases, a lower figure than numbers generally seen from June and late July. In the past week, figures from the NCDC also show a decline in the rate of number of deaths. What can this be attributed to? In Lagos, Kaduna, and Jigawa states, the ban on schools and places of worship has been lifted, and they have been instructed to reopen, but with strict adherence to COVID-19 protocols. Now, since the outbreak of this virus, there has been much said about flattening the curve. Has Nigeria reached this stage given recent developments, or must we remain on high alert about the unseen and deadly COVID-19? Has Nigeria been able to curb the spread of the virus? Is the capacity of testing for it still reasonable? And how well are citizens adhering to the COVID-19 protocols? These are some of the issues on the table as our guests will speak on the topic COVID-19 flattening the curve. Questions indeed that needs some answers. Welcome to Nigeria Today. I am Dennis Adigunloye. All right, joining me in the studio to discuss COVID-19 flattening the curve is Dr. Isaac Igboja, a public health specialist. Welcome once again to Nigeria Today.
You're welcome. Good evening.
All right. And also joining us via Skype from Lagos to throw more light on the issue is Dr. Rita Oladele. She is a consultant clinical microbiologist at the Lagos University Teaching Hospital and a senior lecturer at UniLag. You're welcome to the program.
Thank you for having me on set.
I'll come back to you very shortly. Let's begin with Dr. Isaac. When we talk about flattening the curve, I believe we're talking basically not only about reducing cases, but keeping them at a manageable level for health practitioners. Just in layman's terms, just to highlight for us or explain to us exactly what we mean when we talk about flattening the curve.
Okay, good evening. Let me start by thanking, as usual, all health workers wherever they are in the country. It is a usual habit to thank them because of their sacrifices. And wherever they are, whether they are doctors, nurses, pharmacists, drivers, support staff, whatever level, I want to thank everybody from the bottom of my heart, and I'm sure many Nigerians are also thanking you for your sacrifices. Continue the good work, and God will see us through.
Amen.
Well, coming to the answer to your question, when we talk of flattening the curve, we mean that, as you would have observed, since the beginning of this pandemic, the figures have been going up, 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 up. What we mean by flattening the curve is that it should reach a point where instead of going up, it starts to come down, and even if not dropping down drastically, it remains like a flat line. That is what we mean by flattening the curve. The curve is going up, down. We want it to flatten. After some point, it will start dropping. That is what we mean by flattening the curve. And numbers-wise, it means that the number of cases and deaths that we've been recording will be reducing to a point where they are almost every day they're about the same for some time, and then they start dropping just the way they started going up. They will also start coming down. That's what we mean by flattening the curve.
Okay. What about in terms of the manageable levels at hospitals for the health practitioners?
Well, if you talk of manageable level, we would want it to be zero. That's what we want to have. Unfortunately, because of the large number of cases that we have and the population that we have in the country, it is not going to be possible for us to have zero case or no number of patients at all immediately. It will take some time. We will get there. But for now, we are looking at reducing the number of cases, reducing the number of deaths to a very bare minimal. That's what we mean.
All right, we'll come back to you shortly. Let's come to Dr. Rita Oladele now joining us via Skype in Lagos. The mortality rate, as reported by the NCDC, is said to be very low or in the last week. What would you say this is telling us? Are we having, is this giving us a false sense of security?
No, I don't think it's given us a false sense of security. It just shows that our healthcare workers, especially the NCDC, is on top of the game because the guidelines, they're adapting the guidelines as they come on. Don't forget, recently we also got a new study showed that steroids do help outcomes. So as we modify this, as the virus is better understood, patients have been better managed. So I guess that can account for our dwindling mortality rate, and I sincerely hope we keep it at that.
All right, and generally, low figures, as said in the introduction, have been consistent for a week as compared to June and some parts of July. What would you say this is projecting?
Well, I think I would be a little bit cautious to say that we are flattening the curve. It does appear so. But it also shows we have to look at the total pictures. If we're testing enough, it shows that the procedures that the government have put in place, led by NCDC, are effective in preventing, in curbing the spread of the infection. That's what it means. But it's a data that should be interpreted with care. I do think we should give ourselves another week or two before we can categorically say that yes, the curve is flattening. But if it is flattening, it shows that we are winning the war, that the tax team, the presidential tax team and NCDC have been on top of their game, and they've been able to curb or limit the spread of the virus. And so that would be kudos to them.
And in your opinion, from your observations, would you say that generally Nigerians are adhering to the health advisories, or would you say that there's a little bit of indifference and carefree attitude?
So I think I'll put my tongue in my cheek for that. I think Nigerians are relatively indifferent to it. You know, we have our peculiar challenges in Nigeria where most people live from hand to mouth. So it's been a case of having to choose the virus or having to choose hunger, death by hunger. And then I think another good thing for us is our weather. I mean, despite the rains, the weather has still been relatively hot. So that could have been helpful. But I don't think Nigerians are taking the measures as seriously as we want them to.
All right, Dr. Isaac, I'm sure you concur to some extent with that observation.
I totally agree with her. We've not reached a point where we can confidently say that the curve is beginning to flatten. You recall that about 2 months ago, at the beginning of June, precisely, a question was asked here in the studio when the figures started going up sharply, 600, 500 and something, and so on and so forth. A question was asked as to what could be the reason. I think the same question could also be asked now. What is the reason for this little drop? And the answer at that time was, it could well be that we are testing more and therefore we are seeing more cases. It could well be that the outbreak was spreading to the communities and therefore the numbers were increasing. And likewise right now, with the numbers reducing, we have to be cautious. We are not in a position yet to say categorically that we are winning, or that we have won, or that the measures that we put in place have worked. We can say that the measures we put in place are working. That one is certainly true. And the fact that it is just a few days yet does not give us that certainty, that comfort, that assurance that it would continue. Let's see for the next maybe two weeks. If the figures continue to remain the same or drop gradually as they are dropping, then we can at that point say that the curve might, even at that point, we would say, might be flattening.
Oh, definitely.
Because it is possible that it could spike up. The point I'm trying to make is this. Just like we said earlier, that the reason for the spike 2 months ago could have been that they were testing more. Or the spread had now gone to the community and therefore the numbers were increasing. It could also mean at this point too that people are responding more now, people are more aware, and the measures put in place are working. Or if we want to play the devil's advocate, you could say that it is possible that it is not because we are really winning. Maybe there's a slack somewhere, and that could be a reason for the drop. Slack meaning the number of cases tested may not be consistently as high as they were doing. But from what we hear from CDC, they are testing, the number of people that are tested continue to remain relatively the same, and increasing a little bit in some cases, in some states.
All right. The program is Nigeria Today. We are discussing COVID-19 and flattening the curve, as the case may be. We'll be back after this timeout. Do stay with us.
The number of the COVID-19 cases in Nigeria is increasing daily, with many more tests ongoing. The battle of testing, isolating, treating, and attending to the affected persons rests heavily on the shoulders of our health workers, constantly putting their lives on the line and at risk to contain this virus, save and protect the lives of millions of Nigerians. To these health workers, we at the Nigerian Television Authority, NTA, on behalf of millions of Nigerians, say a big thank you for all that you have done and are doing. To the security agencies enforcing the lockdown and every other frontliner, we say thank you for putting your lives on the line to save ours. There is no amount of words that can quantify our gratitude. Thank you. This message is brought to you by the Nigerian Television Authority, NTA, Africa's largest television network.
All right, welcome back. The program is Nigeria Today. If you've just joined us, on our topic is COVID-19 and flattening the curve. Our guests are Dr. Isaac Egbuja, public health specialist, and via Skype from Lagos, Dr. Rita Oladele, consultant clinical microbiologist at Lagos University Teaching Hospital and senior lecturer at Unilag. Dr. Rita, just not too far away from you in Ogun State, there have been complaints from parents that have been asked to pay 25,000 naira for children, their wards going back to school in the private sector, as against public schools. So, you know, they want, the directive has been for them to pay 25,000 for testing. Would you agree with this this position from the Ogun State government, or is this a bit high-handed?
So I'm sure that the government probably have did their arithmetic and came up with that cost implication. But I do know that this test is meant to be free, according to the federal government. And I do know that some children in Lagos that live in Lagos and probably school in Ogun State have been able to access that test for free at the National Institute of Medical Research, NIMA, which is a federal government establishment. So the test is meant to be free, but if the government does not have the facility or does not have the ability to do that, and they probably are getting private labs to do it for the children, maybe that's why, but the test is meant to be free. Here in the Lagos University Teaching Hospital and most of Lagos that I know of, the test is free. The Commissioner of Health specifically emphasizes it over and over again so that people come out. If they suspect they have the case, to come out and be tested, and they know that it's free.
And what is your position on or observation on the testing capacity and levels currently in Lagos and generally around the country?
For those that cannot afford it and are symptomatic, you are going to lose those cases, and we're in a phase of community spread. So that means the people, those individuals are at risk of spreading it in the community. I don't think it's a particularly smart move, but like I said, it just might be that the government does not have the capacity or the resource, the materials to do the testing. That's why there's a cost implication to it.
And schools and religious organizations have been instructed to open, for example, in Jigawa, Kaduna, and Lagos states. What would be your advice to state governors? And if any, do you envisage any risks once these places of worship are opened?
Oh, yes, there'll be risk. I mean, there's a significant risk in that because, like we all know, testing is not still at maximum. So it's good that they test not the children, but the staff also. But the challenge in that is that the staffs do not live in the school. So even if the children are coming in, they are going back into the community or they're going to stay in the school, the staff come into the school and they go back into the community. So if they are testing negative today and they do not have at the back of their mind the basic infection prevention control procedures, they don't know it and they don't adhere to it, they'll go back into the community and they'll pick it and they'll bring it into the schools and the children can get it. So the government must put down stringent measures, okay, and must ensure that everybody is trained to understand the risks and to identify where the risks are and to make sure that they mitigate those risks. If that is not done, we are sitting on a time bomb.
All right, Dr. Isaac, let me come back to you now. Asymptomatic patients, they seem to be a bit of a challenge in this this fight against the coronavirus. If you're walking around without, well, how you have it, but you're not displaying any symptoms, how can you be identified as a carrier and a potential individual that can spread the virus?
Well, the only way of identifying the person is by testing. There's no other way.
Yeah.
And that's why testing is very important. And that's why I'm worried too, that if there are situations where, from the questions you asked my colleague, where they are charging students to before they are tested,
yeah,
it could be counterproductive.
Exactly.
And in fact, very dangerous because you know that right now in the country, things are very, very difficult for parents,
yes,
to say the least. And if they are able to pay school fees and you come up now with this kind of exorbitant charge, you're not talking of 2,000 naira, 3,000 or 5,000 naira, you're talking of 20-something thousand naira. That's equivalent to school fees in some schools, or a term school fees in some schools. And if a person is unable, a student is unable to pay, it means that that student could be a carrier and will be walking around infecting other people, yeah, especially if the person is asymptomatic, and nobody will pick it. I'm particularly worried about schools that are day schools. For boarding schools, I think one could relatively feel a little safer as a parent, yeah, or as a health worker, because you know that when they are in school, you can monitor what they are doing in the school, what the principal is supposed to do or not do. what the conditions that should be adhered to in the schools. Fortunately, the Federal Ministry of Education, for example, has discussed extensively with principals in some schools, and they understand what is expected of them. But when you have students that are these students that would go to school and come back to the house and go again the next day, how are you sure that the public transport that they take with
Not
people,
come into contact with someone,
with all kinds of people in the buses, that they will not get into trouble in those buses? If things were to be done properly, and if we were able to afford it, the thing to do is to have assigned vehicles that are specifically for students in parks, so that these vehicles will take students to their schools, to their routes, and not for them to mix with other people.
That's certainly
very dangerous. Like Doctor just said, it's a time bomb. It's a possibility that in the future we'll have explosion.
Yeah, we certainly do not hope for that. All right, Dr. Rita, what would be your advice to Nigerians who are skeptical of the daily figures released by NCDC and are therefore non-compliant with laid down health advisories? What's your advice to them?
I think I will advise them that one, COVID-19 as a disease is real. I think we have been fortunate enough to keep the mortality rate down. But despite the mortality rate involved, the sickness, even the mild and the moderate form, are severe enough, and they have sequelae. After recovery, there are still people that struggle with their health for some time. So they need to adhere to the guidelines that have been put in place. They need to wash their hands regularly, proper hand washing. They need to use the face masks and maintain social distancing. We can do it. I mean, we as a people are one of the most resilient people in the world. We can lead the rest of the world in this because we are very resilient. We need to do the social distancing. We need to use the face masks. And we do need to perform hand hygiene regularly. So COVID-19 is real, but we can beat it, and it is easy. Just keep to the guidelines. Every one of us, and then remind your neighbors, remind your friends, re-emphasize it till everybody is on the same page about COVID-19 infection.
Dr. Rita Oladele, consultant clinical microbiologist at Lagos University Teaching Hospital and senior lecturer Unilag. Many thanks for being with us on Nigeria Today and for sharing your thoughts with us.
Thank you so much. I'm happy to have been here.
All right, you're welcome. And thanks as ever to Dr. Isaac Igbuja, public health specialist. Thanks also for your insight and expertise.
My pleasure.
All right.
Glad to be here.
Sure. We certainly hope to have you once again in the future. And thanks to you out there for watching. And remember, Nigeria Today airs every weekday at 7:30 in the evening. You can also watch this and other editions on youtube.com/NTA News 24 Hub. I am Dennis Adigno. Thanks for your time.